I am a licensed and trained naturopathic physician. I chose that. I'm a doctor by choice and a nurse by necessity. I'll explain that later. But I went to naturopathic medical school. I did the pre-med, and then I went to naturopathic medical school in Connecticut. And there are tenets in naturopathic medicine and also laws. And the laws are to increase the vital force, to normalize the blood and the lymph, and also to take the waste out. And then some of the tenets are to find the root cause of disease. Like, I think to simplify it, if you looked at any chronic disease, one item that is true with chronic disease is that there is oxygen deficiency. And that's why I think it got a lot of people interested in ozone therapy and oxidative therapies. So you have oxygen deficiency. You usually have a gut dysbiosis, meaning that there is an abnormal balance of flora or bacteria in the what's called the microbiome now. I think people are familiar with that term, but in the GI tract. So it allows negative or bad bacteria to take over that are pathogenic, meaning that cause disease. You also have epigenetics. So some people are kind of born behind the eight ball. I have some patients who have genetically are predisposed towards cardiovascular disease or having high cholesterol. And so what you do is you try and tease this all apart and figure out, well, what are the lifestyle changes the person can realistically make? What can they commit to? What are the oral protocols? Of course, the IV therapies are wonderful because we bypass the liver, we bypass the GI tract so that everything is 100% absorbed. And that was also something that I loved about ozone. When I heard my first lecture on ozone, I thought, well, that just makes sense. It's being absorbed and it's going immediately in a nanosecond. So it's going in, and wherever the blood flows, that's where it's going to. It can make corrections. And once the blood is infused back to the patient, it goes that 62,500 miles around the body, maybe a couple minutes, and going through all the major organs and all the microcirculation. But I think that over the last 5 years, we've seen very different things. And what I've seen is that the immune system has been hijacked. And it's either in a very hyper-responsive state, and there are many markers that I look at for that. Some people would be familiar with them, some people not. But I encourage people to always make sure to get their D-dimer checked, to get ferritin checked, and to get what's called an interleukin panel, so you can see if there's inflammation in the body, and also C-reactive protein. And when people had, for instance, just as an example, COVID, interleukin-6 went through the roof, so did interleukin-8. And then you have to figure out, okay, well, you know that there's a fire going on in the person's body. How do you put it out? What would be the best way to put that out? And so then things came into play like natural anti-inflammatories, like quercetin, like bromelain, like turmeric. And these are things that have been well studied and been studied for over 5,000 years. So we knew that they would be safe, unless someone had an allergy to them. But I think that functional medicine and naturopathic medicine sort of overlap. I think functional medicine just became a term because if it was maybe useful for if someone had gone through an MD training, then if they wanted to branch into alternative medicine or integrative medicine, it just became a term that people were using.
Oh, yeah, that's another term.
Yeah, integrative, yes. So I guess in a way I am integrative because I want to use what not only is safe and effective, but what works. What works? I'm just very practical about that. So if I know a patient is going to do well, or that they need to do chemotherapy. And most people don't wake up and say, well, I want to do chemotherapy, right? It's not something, we call it poison with the purpose. But sometimes that can be life-saving, and it's the appropriate choice to make. Or if someone needs surgery. We had a patient who was 15. The parents uh, only wanted to do alternative medicine, and so I had to document that that's what they were going. But I kept saying, you need to, there is a solution, and you need to see an oncologist, and you also need to see a surgeon,
Really?
because it makes sense, and it also, I think, can save a life. Now, are there problems with conventional medicine? Of course there are, because no camp is perfect. And I think people do better when they kind of put the two together sometimes. But this young woman probably would have died of thyroid cancer had she not had her thyroid removed. But the parents fought it for, several months, and I kept saying, no, she needs to have that. Just like if you had kidney cancer, there is a solution. And if the alternative stuff, maybe it can help buy time, maybe it can help manage. Actually, what I think is really good about alternative medicine is preparing the patient for standard of care medicine, so that they're strong enough to withstand it, so that we know, that we're going to bring the inflammatory markers down first. We're going to make sure that they don't have myocarditis. And I'll share all the labs with anybody I refer to. But I think it's a combination of things, because one modal or one camp is not the be all end all. It's just not the answer. But I think that they work really well together. And I think that's why places like Cancer Treatment Centers of America exist, Invita in Arizona. These are places that are, I would use the term integrative, that they're putting things together. But and if it's more of a simple case, someone's going through menopause or menopause, then that's relatively simple, and we can do labs. And I really do believe in labs, because I think you need to prove your point and make sure you're going in the right direction. And everything is trial and error, whether it's naturopathic medicine, functional medicine, or integrative, or standard of care. It's all experimental. How even a lawyer approaches it, it's a process of discovery. And I want to try and understand as much as I can about the patient, really listening to their history, and make sure that's documented, but also doing the labs so that I can find out whether someone are they pre-diabetic? Are they diabetic? Are they insulin resistant? Do they have a fatty liver? It's what's called GGT. Is that elevated? So I want to have as much information as possible, and then to present to the patient what my recommendations would be, and then and I'll usually say, look, I just want you to try this for a month. Give it a month. And I want you to be as compliant as possible. And then what we can do is reevaluate after that month and see how you're feeling, how you're doing, and then also do a repeat. Now, if there are labs, like if someone comes in and they have a raging pneumonia, I'm going to do the labs sooner than later, because if I put them on doxycycline, if they have Mycoplasma pneumoniae, and I put them on doxycycline for 21 days, then after those 21 days, I want to recheck and make sure that it is gone. The same time, during that 21-day process, they can, and I do offer, do you want to come in for ozone therapy? And I explain what it is. Do you, because I think that will help the process go faster. And I think that ozone in many ways is a wonderful catalyst to even if I'm using conventional medicine. And then when we retest and the patient is clear, then we may move on to whatever else is going on with them. Initially, I did a lot. I do all of the, like a CBC with a diff, so that's a complete blood count with the differential, white blood cells, red blood cells. I did a Chem 14. I did an interferon gamma, interleukin panel, so that's 2, 4, 6, 8, 10, 13, 17, which those were elevated. Even uric acid is now considered an indirect cancer marker. Lactic acid is now considered an indirect cancer marker. Ceruloplasmin to see if there's a problem with the copper transport in the body. I did phospholipid syndrome to see if there was something wrong with that. I checked for a whole autoimmune panel. So an ANA screen, tumor necrosis factor alpha. I checked for all kinds of pathogens. I did a Lyme panel, and then that came with many kind of co-infections. So whether it was toxoplasmosis, chlamydia pneumoniae, mycoplasma pneumoniae. Wow, I'm just trying to think what was in it. I could refer to it. And then also, I'm old-fashioned, so I still check for breast cancer markers. So I did CA15-3, CA27-29. I know oncologists don't even use those anymore. They actually just go right to the imaging. But when someone, let's say they don't have a breast mass, but let's say they're out of range and it comes back in red, then I still want to always follow up, because is it inflammation? It doesn't have to be cancer. Is it that they have dense tissue, or is it early disease? So there's an old saying, an ounce of prevention is worth a pound of cure. And it's still true, but most people don't. And I also check everyone for HLA, DQ2, DQ8. So I check for the genomics of celiac, because most people come up negative for the celiac panel, and that's fine. But I also want to see, are they genetically predisposed? And I also check the methyl tetrahydrofolate reductase, so the MTHFR, C677T, and A1298C. So that can give me an idea whether they have an impaired detoxification pathway or if they're predisposed towards cardiovascular disease. And I had patients who, over the last 5 years, there were just a lot of interesting things coming up. I mean, in 2023, I had 17 cases of brucellosis, which is a kind of a weird bacteria. Most people don't have it. It's reportable. The New York State Department of Health would call. I tried to figure out the pattern or the common denominator with it. Like, well, was it with gender? Was it with ethnicity? Was it with this? Was it people traveling to the farms? Were they, drinking some blood ritual or something like that? The only thing that came up was that they had all been COVID vaccinated. That was the only thing. And that I think what happened was they had this infection, and then the COVID vaccine had hijacked the immune system, and then actually it surfaced. So you could say that it was a silver lining in a way, because then they did get treatment for it, and they had complained and gone to GI specialists, and nobody found anything, and they did an endoscopy and a colonoscopy. Nothing was found because they weren't checking for it. Now, there's always going to be something new that I don't know about that won't have a test available. So there's always a new virus. There's always a new pathogen on the loose. And there may or may not be a test for it. But I try to look for patterns and see what's happening with the person's health. Plus, you can, do physical exam. I check everyone for full hepatitis. I check everyone for human herpes 6. I check everyone for galactin-3, which can relate to congestive heart failure and or cancer. I check everyone for iodine levels, and I check all vitamins. And I have colleagues who just do hair mineral analysis, which I think is probably very valuable. I usually just check it in the blood. But even in the blood, it's also of value because I can see when someone's very low with their vitamin D. And then if we do a trial with replenishment, and then if it's not working, then we have to figure out, well, why isn't it working? So I do like to be thorough. I think that's what you could. I always say when I present at a conference that I'm called the C word, comprehensive. I think I was driven. I know I was called to go to naturopathic medical school because I had a lot of choices, and at that time they were looking for older women even to go to Columbia. And I thought about that, and I thought about midwife, and I thought about chiropractic, everything. But naturopathic medicine made the most sense to me. And I thought, wow, if we could figure out the root cause of disease, then we're kind of ahead of the curve. Then if we can correct and address that root cause of disease, then maybe we can reverse chronic disease. And then I went, in my third year of medical school, I studied at a very famous cancer hospital in Switzerland. And it was an anthroposophic hospital. I went to the only medical school where they made us write a 200-page thesis on top of like 15 papers every semester. And so I thought, well, what am I going to write my thesis on? And then I just started reading, and then this name came to me, Viscum album. And then it turned out that Weleda made a product called Isadora. And I thought, well, this is fascinating. And then at that time, I had a neighbor who happened to be the CEO of Weleda USA. They're no longer. They're based in Europe. I told him I was interested in doing my thesis on this because mistletoe sounded so interesting as a treatment for cancer and all kinds of cancers. And it had been well studied for 80 years. And also that they would use it for MS and for other inflammatory conditions. So he said, oh, well, I'll help you. He said, I'll connect you with this person, and then you'll go at Easter time when they're making Iscador, and they make it in this room with all this incredible equipment, and you're kind of in a lockdown. Like when you're in the room and they're making the medicines, you don't leave. You don't do anything. And they also meditate while they're making the medicine. And so I went to this hospital, and I thought, this is just a whole different paradigm. They're treating people so nicely. The sicker you were, the nicer the room you got. And that they individualized your diet. And they did it through these, what I would call tiddlywinks. So that it was like the chef knew how to make the food for the person, but the person was not ostracized for how they were eating or what they were eating. They went to concerts every night, and they had these organic baths, and then they had all these different medicines they did. When the doctor came in to each patient every morning and sat on the bed so that the patient could feel their presence. And it was so patient-centric and loving. And every patient also was given a musical instrument based on their cancer. And their flowers were thoughtfully arranged and changed every day based on how they were responding to treatment. If they talked in their sleep, it got documented. Everything was very, very thoughtful about it. And people did well there. Not everyone, of course, it's never 100%. But it was a wonderful place. And then they, of course, used a lot of mistletoe. And those are injections that are usually given into the abdomen, sub-Q. There are doctors, too, who also do IV, but they're very well trained. It's advanced training for that. And then there's even mistletoe, even in a tincture form. But mistletoe was discovered, I think, by Rudolf Steiner, And then it was well studied, and I think a lot of people were part of this. Went through a lot of iterations, medical iterations, and using it for bladder cancer and lung cancer and stomach cancer and breast cancer, and it is still used today all over the world. And that there are trainings for it, advanced trainings through the Anthroposophical Society. So I came back to in my third year of medical school, and then I thought, well, what causes cancer? Oh, I gave a presentation. I think they were very interested in it, and I explained the mechanisms of how this worked and everything, and I wrote the thesis on it. No, I think they were very, very interested, but I don't know that they were going to go at the same commitment level that I was, to do it. And also, the medical school was in the process of being certified. So it was, and we had to be in our seats by 8 o'clock, a recertification. Yeah. Yeah. And so there was lots of things with that going on. And then you were licensed in Connecticut as a primary care doctor. But even at that time, when I graduated, you couldn't do any IVs. You couldn't even order labs. It was very restrictive. So I think what happened was that they were very comfortable with, saying that they were doctors, but then like all dressed up, but nowhere to go. So then I wanted to do more, and I also wanted to come to New York. I was a licensed massage therapist. And then, so what happened in the process was I was chosen in some lottery. I don't even remember putting my name in, but because there was a 4-year waiting list for nursing school. And my name got chosen for an accelerated version of that. So I went to a community college, Rockland Community College for nursing, and then went through that program, and then also got a master's. So it became a family nurse practitioner so that I can practice, and have more scope of practice. And I even have more scope of practice in Connecticut, where I'm licensed in Connecticut and several other states, than as a naturopathic physician. Prescribing, yes, I can prescribe. So even with prescriptions, like if someone needs an antibiotic and it's appropriate, I will prescribe it for sure. You have to factor in all these environmental factors. And like I said, when I got back from Switzerland, I then started thinking, well, I need to figure out what triggers or what causes cancer. And there could be so many variables. So then I went and studied with Dr. Crinian, Walter Crinian, and became board certified with environmental medicine, which is this whole, it's this whole world in and of itself. Very depressing, actually. But, and then beyond that world is also epigenetics. So how do we get to cancer? It's the perfect storm. It doesn't happen overnight, typically, unless you're at Fukushima or something, you have an incident. But it happens over time. And it matters even if there's DNA adduct damage in your parents or your grandparents, and how that then affects, how that comes through, that there's intergenerational epigenetics, right? Just like they talk about intergenerational trauma. And so it's looking at all these things and figuring out, well, how can we clear that or clear this? What modalities or treatments would be useful. And the other thing is you always need to do is prove, are they working? Are you going to continue, like with this one patient I just mentioned who has Lyme, CLL, and the nasopharynx cancer? They kept pushing the standard of care medicines and made him so sick that they then had to reach a conclusion that they had to stop. So it's balancing out and creating some kind of professional wisdom. Is it working? The young woman who has the breast mass, the mother was putting turmeric paste on it and hoping and praying to God that this was going to miraculously cure her. That would be great if that happened. But, it didn't. It did not happen. And so there is a fine balance with really sticking with being reality-based, but also developing an intuition and being curious. You're applying the turmeric to where? In the mouth?
Oh, no, right on my breast.
Oh, right on your breast. Okay. So it depends on if it's, and is there a tumor there?
You think so?
Yeah. So one, is it absorbed and how much is absorbed? We don't know, right? We can't measure it. So I don't think it's going to hurt, but I wouldn't say that this is a cure. And I never use the word cure. And I know people want to apply poultices and different things to sort of bring the bad humors out or make the tumor shrink. I think what is more effective is injections, intratumoral injections, quite frankly. I think that's more effective. And I also think if you are not allergic to turmeric, to do IV curcumin, if you're not allergic to it. And then to follow the labs to make sure whatever markers you're using, that there should be a way to, or imaging, that it should be working. And I usually say 6 sessions. It's a gentle way. Yeah, just like you could use ozonated glycerin, right? And which you could apply topically, which you could inject, which you could go to someone to do an IV if they do it appropriately, because it really has to be diluted, right? To do it. So it's this gray area, which I think is difficult for everyone. And we all want homeostasis. Everyone wants homeostasis. And of course, everyone wants to be cancer-free. But in doing so, we want to find the best method that's going to work.
It sounds so like when you came back from Switzerland, they didn't automatically reject. They kind of accepted and were willing to listen.
Yeah, willing to listen, but then I was caught in the legal bind of that naturopaths couldn't do anything. And they wouldn't, and I spoke with Alita about it. I said, okay, now I'm a licensed naturopathic doctor. How can I give mistletoe? And they had no way of doing that, really, at the time, because you needed a different license in order to do the injections. It has changed for, like if there's a naturopath who's gone to Bastille or National or in Chicago, their scope of practices, or Southwest, they can prescribe, they can do injections and all of that. But Connecticut,
the state has said that?
yes, yeah. So their scope of practice is much broader. And
Who's responsible for making that change?
Oh, people in a naturopathic, so people who are responsible for making that change, that they would have a naturopathic society or group, and then they would lobby to change legislation. In New York State, they've never been successful with that. Even though, we would go up to Albany, we would have a lobby day 9 years in a row. We paid a lobbyist. They would shake our hand. They would say, you guys are doing great work. But then they would never change anything. And because it's the powers that be. So if the AMA had a strong lobby and they were giving more money because that's how it works, then it was never actually going to change.
Why would an AMA object to what you were doing here?
That's a good question. Why would the AMA object to what we're doing? I don't know if it's out of fear and then just misguided education about what we do. is it about money? And is it about taking something away? I've never been clear on that of why they would object. And I think people who are going through, standard medical school are asking a lot more questions now. But I think that some schools are trying to, like when I went to school in Bridgeport, we had an association with Yale. So we were like a feather in their cap because they started an integrative clinic. And I think that was a bonus to them. And we went to school with many of the Yale medical students, although they didn't always show up to class. They're maybe too busy being brilliant in their rooms. But anyway, I'm old-fashioned. I believe in showing up and being present and doing the work. I believe in doing the work. I think in the past I have, and I think in the past I've had different doctors hang up the phone on me because, like, there was a case of a patient who I did labs on her, and I knew she had parvo 19. And I knew that's why she had splenomegaly, an enlarged spleen. And so I called the surgeon to say, "Oh, this is what is going on." So I have had people hang up the phone, and and I'm not here to trespass or make someone feel bad or feel like they missed something. I hope that they would regard me as, oh, well, thank you for just doing that piece, and that's good information so I can also know that about the patient. I like to work in a team. I've spoken to different groups, whether it's a Parkinson's group or a cancer group or something at the library. I think it's really more of a grassroots effort. And I think that even, I'll give you an example, during COVID, I tried to get into the hospital. I called hospitals and I said, this is no charge. You don't have to pay me a thing. I have a Herman machine and we can do ozone. I know that it's been, widely used in different parts of Europe and that it was very helpful and that it stopped the cytokine storm. It did save lives. And I kept pushing for that. I contacted the governors of 3 states to say that, just give me some space. I'll train people and I could have colleagues come in and they have machines on standby. But I never got a response. So, yeah. They did vitamin C, I think, in New Jersey at one hospital for a short time. But they would not do ozone. They would not do it. And even it was certainly written up I remember that article was in the New York Times. And even the World Health Organization had done a study about ozone with COVID, saying that it was a proven treatment or cure for COVID. But when I put that published study on Facebook, then they immediately took it down. So I think it's hard to work through the suppression. And I don't, that's a very good question. Why would the AMA why would they be against that if it's, so are we talking about managing disease or trying to reverse it? When the first day of my medical school, they asked a question, which I thought was very poignant and salient. Do you put a guardrail at the top of the cliff or do you put an ambulance at the bottom? I was a very late bloomer. I went to college, and I think I was a very, very lost, actually, when I first went to college. I graduated early from high school. I was around 16. But I then, at 17, went to college. I don't think I know what I was doing at all. In fact, I remember signing up for a logic class, and that seemed so complicated to me, I had to, drop out of it. I didn't understand it at all. So I tried to avoid the sciences. And then I went into the arts, and I graduated with a degree in a Bachelor of Arts in dance, modern dance. So I was a choreographer and a modern dancer for several years. And I would, apply for grants from the NEA. Yeah, in Chicago. And it was a time during the 80s where You could live on basically nothing, like less than $10,000 a year, and you could be an artist. You could define yourself as that. And I had a company, and I was an artist in residence and performed at Fermi Labs, and then I got a choreographic fellowship. And so I thought, well, this is, I want to hit the big time. I'm going to come to New York and like everyone else. And so I came to New York with this choreographic fellowship and ended up cleaning houses. Okay. And then graduated from cleaning houses to, I think I became a medical coder. And I thought, well, I better do something with my life. So then I thought, well, maybe I'll be a massage therapist. So I went through the training. It was probably 28. And then I had a successful massage therapy practice for many years, maybe 16 years.
In New York?
In New York. And I was, written up in Vogue and different magazines. And, I had a very, high-end clientele. And then I thought, but I was getting tired. It's physically demanding. I was doing like 14-hour days. So I thought, well, I gotta do something else. This is too much. So then I thought about these other options. But then, and it took 6 years because I've always worked. No one's ever helped me in terms of education, which is fine because I really value it. And it took 6 years to accrue 52 credits of science. I had to take organic chemistry with a lab, inorganic chemistry with a lab, physics with a lab for a year. These were all for a year. I had to take statistics. I had to take math. I had to take microbiology, psychology, all these different things. But I blossomed. I loved it. I love science. Then, very proudly, at the tender young age of 42, I applied and got into naturopathic medical school. And I think certain people are okay to go to medical school when they do at like 22. But I also really feel strongly that I think you should probably be over 35, that you should have some life experience to take that kind of responsibility if you're going to say you're a doctor. And I went to naturopathic medical school, which was a fabulous world. My mother was not supportive. She said, you shouldn't go to medical school. She thought I was, too old, and it was going to be debt that I was creating. I had adopted a daughter. I had a partner at that time. But I really had no family support. They were not, even emotional support. But I knew I had to do it. I knew that this was it, that I wanted to help people, and it made sense, and that I don't know how to explain it. It just was a calling. And I loved learning. I absolutely loved learning. And when I was there, I started the first naturopathic 9/11 clinic after 9/11. I got lots of donations from lots of different companies, so we could do it, and it was going to be free for anybody who came. I raised money for the school. I got us on Channel 8 News. I did an herbal garden so we could, really educate people in the community. And did a lot of different things to try and boost who we are and what we are, and so that we could, see people in the clinic. And it was a wonderful clinic. It's one of the tenets of being a naturopathic physician. Doctor is teacher. And I know that education is so vital in terms of if you explain what it is that you're doing, and that there's an option. I believe in options for people, and that so they can make choices. And I think that that's very important. Just like in the oncology world, yes, of course, there's standard of care medicine, but there's also these other things. So when someone has a dry mouth or they have nausea, of course they can offer Zofran, but we can also offer ginger syrup, or we could do, something else. There's ways that we can correct the anomalies that are caused from chemotherapy. And we can do them in a homeopathic version and also in a cost-effective version. It doesn't have to be that it's expensive medicine. Yeah, I would consistently present at different. I would call groups, and say, could I do a presentation? Or I would call the library and say, could I do a presentation on this? And then, have them give me a room and then do a PowerPoint presentation. I don't know. I guess it's just something inside of me that just really feels very strongly about this greater good, or this sense of greater good, and also a responsibility to educate people that there are treatment options. Because of this association with Yale, we had fantastic teachers who I thought were very, very good. And yes, I think that modeling, and then also the preceptorships that we did, that we had to do to go through school. Preceptorship would be that in the last 2 years, you had to do clinical rotations. So you would study with different people, and I got to study with some wonderful people, including Dr. Diadamo Sr., who you probably know as the blood type guru guy. He's no longer with us, but his son, Peter, has furthered that research and had a whole center, a department at University of Bridgeport. I even treated people for free during COVID, a lot of first responders, because I knew I had a modality. I knew that they had the option of going to the hospital. And I know in particular, one firefighter came in, his pulse ox was like 81. That would be particularly low. And I said to him, we can do this treatment, but if this doesn't work, I'm going to call an ambulance immediately. But within one session, his pulse ox went from 81 to 96. And then after a second session went to 98 and was fine. And he, thanks me for the work. It's just about making things accessible and educating people so that they know that they're there too. I've gone through, when I was the Office of Professional Discipline, that they sent someone in because I was wearing a white coat, but someone could call up and say anything. They could make a false accusation. And then they have, of course, they have to follow through with that. And I don't even know if anything came of it. I think maybe I had a fine or something. And then they said I was going to need to be supervised, but no one showed up to supervise me. Nothing came of that. You never know if someone calls or who calls about anything. And I think, New York State, they had questions because I was doing a post-vax detox protocol. So they had questions about that. And I explained it to them. I, didn't have anything to hide, following all the other rules. They send somebody in to talk, and then they, they'll ask questions, which was kind of funny because then 3 people came in, and one woman I knew was coming, and, then they checked to see what your equipment is like and everything. And then she brought in a second woman, and I said, well, who's this? And she said, oh, this is your liaison to the Department of Health. And I said, really? Why didn't she contact me like months ago to let me know, if I was, so that I was set up properly? It's not friendly either, I don't think. In New York State, ozone is legal. And I think that was because of Dr. Atkins, right? Yeah. It was funny because they had sent information ahead of time They came on a Wednesday, but the Friday before, then I got an email from the Department of Health, all about COVID and the COVID vaccines and so forth. And when she came in, she was asking me questions, and she said, "Oh, that's not right." I said, "No, it is right." I had to point out to her from the Department of Health that this was correct, because the Department of Health just sent me this information. So it was a little bit of a funny thing. And I said, "Do you not read what your department sends out?" So I understand they're just wanting to make sure that people are safe. I get that. So there is an association. There are naturopathic physicians who practice, I guess, in New York. I don't practice as a naturopathic physician in New York. I practice as a family nurse practitioner. So I follow all the rules. Also, I retrain all the time. So I just went through a retraining for my family nurse practitioner. It's like 40 CEUs. And I retrain constantly, with the CEUs about different things. I think you have to remove that financial incentive, which, how would you do that? Because there is good research from Big Pharma at times, but it is with self-interest. There are advances even with cancer, right? Immunotherapy and different things. How did we get that? How did we get there? I'm not sure how we're so embedded in the system, and yet it doesn't work, because I just had a patient who said, "I'm paying $1,000 a month for health insurance, but I just had to go get some imaging and I had to pay $600 for that, even though I'm paying $1,000 a month for health insurance." And if I go to my primary care doctor, they cannot or will not order a vitamin D test. So then I have to go elsewhere, which is really interesting, because now LabCorp is selling directly to the consumer. Now Big Pharma owns Walgreens and CVS. And so and LabCorp is now in Walgreens. You could go get a blood test. Now they make it convenient. So if you need, like a vaccine, you could go to Walgreens or CVS to get the vaccine. You don't have to see a healthcare provider, because now the pharmacist has a scope of practice that has expanded. Yeah, how did we get here? Wow. And then I don't know, with each administration, including even the present one, no one knows what's going to happen with healthcare. We're just not sure. Someone says one thing on the news on one channel, someone says another thing on another channel. I don't know how to verify some of these things. What is it all going to look like? I know people, what I think is common with most people is that they feel betrayed. They feel angry and betrayed, no matter where, who they voted for, what's going on in their life, but they feel confused and betrayed and angry, because it's become overwhelming in terms of managing uncertainty. And I learned from a really wonderful doctor years ago, if you go into medicine, all you're doing is managing uncertainty. So if you can't handle that, that's probably not a good place to be. But actually, life is uncertain. I feel like I'm fulfilling my purpose in life, and that I always kind of ask the universe, should I continue to do this? And then I see that then I'm supposed to see, a full day of patients. And my sole purpose is helping people to better their baseline of health. Learn to live better, improve the quality of life. If they have symptoms from any condition, to resolve those symptoms. And even if they're born with what we would call a dirty gene, but to learn to manage that, so that we don't set it off, we don't light it up. And I think that's what I feel like I'm cleaning up a lot from COVID is that was a trigger for in many people in their biology for other conditions that were under the surface that they did not even know about. The body does have an innate wisdom. I believe the body does always want to correct when it can, and that you have to remove the obstacles to get that correction. They say that remove the obstacles to cure, but taking out that word of, just at least getting to a better baseline of health. Yes, because scars are part of the autonomic nervous system. Mm-hmm. So you could have a scar somewhere on your body, but might affect another part of your body somewhere else. So releasing a scar is very important. I have underneath a scar, and then what it does is I think it goes in and releases the matrix of that scar, which, if you want to use Chinese medicine terms, trapped energy. But it allows for the meridians and the energy to flow smoothly. And people usually feel better, whether it's a C-section scar or for a knee replacement surgery, or that scar is stronger, right? It's a matrix of like glued tissue together. And I think it really is an energetic release, but I don't know how to explain it in another way. They didn't know how aspirin worked for 100 years.
Yeah.
Right?
But we use it.
But we use it. They didn't know how monoclonal antibodies worked, really. We didn't know all of these different things. Yeah. So it's always going to be never ending. There's never going to be answers to all the questions. And then you're talking about unique snowflakes. Everybody's a unique snowflake. And even with any condition, I always say, why this, why now? It's a question, because what led up to this? And then how can we deconstruct it? What can we change today that's going to make an improvement in your health right today? And then waiting for the labs to come back to maybe work on some of the deeper stuff. And I do all the hormones, and I do full thyroid, and I do food allergy panels, respiratory allergy panels. There certainly seems to be a pattern. Women who have more food allergies, I think, are at higher risk for breast cancer, because there's just always general inflammation going on. Inflammation certainly is at the genesis. If we looked at those things like epigenetics and pathogens and inflammation, sources of inflammation, environmental toxicants, predisposition, also microbiome, all these things that then just contribute to the perfect storm. And then it reaches a point where the body cannot compensate. And then it breaks. Or you will have a chronic disease, or you'll have a neoplastic condition. But it's the body's cry, I think. It's an alarm. I think we have a pretty good alarm system. And we just have to pay closer attention. So currently, I'm seeing patients who have very complicated medical conditions. They don't usually have one thing. For instance, I had a new patient yesterday, and that patient is in his mid-60s. He has a history of Lyme. He actually has acute chronic Lyme. The doctor did the right lab work on him, but then didn't really follow up with treatment. So that's going on. He also has CLL, chronic lymphocytic leukemia, and he also has a very rare nasopharynx cancer, which is linked to EBV, Epstein-Barr virus. And so he has gone through, he had a squamous cell carcinoma in the same area about 22 years ago. He did radiation therapy at that time. They said he was cancer-free. And then 22 years later, and probably COVID didn't help, but something got reactivated. And so he went through 2 rounds of chemotherapy. They also then incorporated immunotherapy, which made him very ill. For some reason, it just didn't seem to work, and it made him worse. So at this point, they are stopping the chemo and the immunotherapy, and that was even on the basis of, or the direction of the doctor. So he's in this window where he is coming to me for some adjunctive care. I think his daughter, who just became a nurse, had looked up online and then also had spoken to people and then spoke to a patient who had stage 3 colorectal cancer and also hepatitis C, and that she vouched for me and gave a referral. This is a man who was 170 pounds and now weighs 124. And so we're at a point where I think one of the goals would be, if it's possible, to stop the progression of the cancer, to repair damage if possible, certainly rebuild his immune system. He has anemia, so we need to build that up, both the white blood cells, red blood cells. He's reality based, and what we want to do is improve quality of life. And we also want to extend his life if possible, longevity. And so in terms of quality of life, his main complaint or chief complaint was severe fatigue, because he has mitochondrial damage. So we want to improve that. And I believe that ozone is a very proficient modality to do that. I also use homotoxicology remedies, so from Germany, that are made under, sterile conditions. So I could use things to help correct any thing that needed to be corrected in what's called the Krebs cycle. And the Krebs cycle is how we produce energy, units of energy, ATP. He also had difficulty swallowing at one point. That is getting better. And we want to make sure that he's absorbing vitamins and minerals and nutrients and things that he's eating, so that he can put weight on and then regain muscle mass. So that's one patient. I have another patient who's 25 who has a large breast mass. And I know that she'll have to do standard of care medicine, but we were doing also alternative ozone. We did IV curcumin, we did IV artesunate, and she's on oral protocols as well. So they're pretty complicated cases. I mean, sometimes I'll get something simple like eczema in a child, or maybe someone just wants to increase their general wellness, or maybe they just have high cholesterol or high blood pressure, that they want to make changes in their lifestyle to correct that. And but I never know what's going to walk through the door. And that's kind of what makes it exciting. And then to figure out, well, what's the safest and the most efficient protocol for them, and also what's realistic. I think in functional medicine or even naturopathic medicine, the patient will come in, and if they are told to take 32 supplements, like from the first time, it's too overwhelming for them. And they may not even have the ability to metabolize what you're telling them to take. Low-dose naltrexone is another thing that is kind of widely used in the oncology world, and also for any inflammatory condition. So if someone has ulcerative colitis, or they have, even for MS, or for any kind of, you could even use it, it's been well studied for like a lot of the inflammatory conditions. So, and I had a patient recently, actually, interstitial lung disease. She had COVID and was very much damaged by COVID. Polish descent. She went to many, many specialists. The one question that they didn't ask her that I asked right away, where were you during Chernobyl?